just kind of moving on to our wrap-up question. This is one that we like to ask, is the crystal ball question. So what positive outcomes can you see coming out of the COVID pandemic in regard to mental health awareness? And we'll start with you again, Katie.
Okay, thanks. I think the biggest kind of silver lining, if there was any silver lining to the pandemic, or a positive that I see coming out of it, is that there's just a new light shown on mental health for the first time. I think people actually experienced a mental health crisis during the pandemic, whether it was social isolation or anxiety, depression. Maybe people who didn't think mental health was a real thing, actually experienced it for the first time. So I think there's just kind of a new light shown on that. And I think the entire world honestly just looks at mental health differently, and that it is a priority, and it should be just as important as our physical health. It should be just as important as going to the doctor for a broken arm. It's something our healthcare system needs to catch up with, and I'm really hoping in the next few years that we see that actually happen. And I also think the other positive thing that kind of came out of the pandemic is people are actually getting help for their mental health for the first time. And like Monica mentioned, our mental health care system is seeing a huge rise in therapy, inpatient, outpatient services, and they can't keep up, which is a negative thing, but I think it's also a good thing, because I think it shows the priority that that we're finally placing on our mental health and how important that is to our overall well-being. So.
Monica, what are your thoughts?
I think primarily I would echo what Katie said, and just also add that the availability of telehealth and teletherapy that exists due to the pandemic has been a win. So it has kind of forced insurance companies to cover a service that maybe in the past they didn't cover to the level they do now, and that would be providing or paying for someone reaching out to a therapist online, to an addiction counselor online. Now, there's a lot of question on the part of therapists and mental health agencies if those services will continue to be covered by third-party payers. And so they're kind of in this weird place right now where do I continue to build my teletherapy practice when that service might be yanked from as a covered service through a Blue Cross, or I don't want to pick on Blue Cross, but that's just what came to mind, by an insurance company. And so I think there's some good lobbying efforts that can be done, and encouragement to our insurance companies to continue to cover teletherapy as a covered service on plans. And that's just a must in rural communities that are underserved with psychiatry, especially for people to be able to access a psychiatrist, to have evals or medication refills. Gosh, the wait time is incredible for those folks. And it puts our primary care physicians in rural areas kind of at a disadvantage, because they're not always comfortable prescribing, especially the more heavy duty meds for mental illness, like antipsychotics and things like that. So if we lose the ability to have telepsychiatry, teletherapy visits covered, that's going to be a big loss. So I would say the pandemic has been awesome for us gaining ground in that area. It's been good for rural communities to have that happen. And we just have to be very vigilant about not going backwards once restrictions are lifted and people are able to have clinic visits again.